Good morning, students. Today's class on forensic psychiatry is about the second part, and in today's class I shall be discussing about the classification of mental diseases and few aspects of psychosis and neurosis, as well as in brief about Mental Health Act and restraint of mentally ill persons. This is the ICD-10 classification of mental disorders given according to WHO classification, that is 1992. Kindly pardon me with the small letters of ICD and WHO. ICD stands for International Classification of Diseases and WHO is World Health Organization, that is being abbreviated as WHO, which is written in small letters. So this is the classification of mental and behavioral disorders. The first one is organic mental disorders. Example include delirium, dementia. The second one is mental disorders due to substance abuse. Substance abuse or mental disorders can be due to alcohol abuse or cocaine abuse or cannabis abuse. I have told you in my class that cannabis abuse can lead to a mental disorder called as run amok, or also called as sometimes hashish insanity. The third one is schizophrenia or schizotypal and delusional disorders. Example include various types of schizophrenia. And the fourth one is affective disorders, also called as mood disorders. Fifth one is neurotic or stress related and somatoform disorders. Examples include anxiety or phobic states or obsessive compulsive disorders. The next one is behavioral syndromes associated with physiological disturbances. Example like eating disorders, sleep disorders or sexual dysfunctions. Next one is disorders of adult personality and behavior. Examples are or is personality disorders. Then there is mental retardation, and the last one is disorders of psychological development. So next one is mental retardation or disorders of psychological development, that is speech and language disorders. Then the next one is behavioral disorders of childhood and adolescent, like the hyperkinetic disorders or tic disorders. The last one is unspecified mental disorders. So these are the various classification of psychosis or mental illness according to WHO. So the next slide I am going to explain about mental age. That is, mental age is nothing but the development of the mental status according to the chronological age of the person. In this, we are also going to calculate what is meant by intelligent quotient. That is, according to Binet-Simon test, it is nothing but the intellectual capacity of a person in relation to his chronological age, which is expressed as percentage. So I repeat, the intelligent quotient is an intellectual capacity of a person in relation to his chronological age, which is expressed in a percentage. So the normal intelligent quotient is between 90 to 110%. Whereas the intelligent quotient in persons who are suffering from mental illness may be different, or person who are mentally retarded, their intelligent quotient level may be below the normal range. So here you see the formula to calculate the intelligent quotient, that is mental age upon chronological age into 100, which gives the intelligent quotient in percentage. So these are the various levels of intelligence and the intelligent quotient range found in mental retarded persons. Not to call mental retarded, it is now expressed as mental subnormality. If a person is having intelligent quotient between 50 to 70, then he is belongs to a category of mild mental subnormality or mental retardation. And if the intelligent quotient is between 35 to 55, then he is considered to be falling in a moderate mental subnormality or mental retardation. If the intelligent quotient is between 20 to 40, then the person is having severe mental retardation or mental subnormality. And if the intelligent quotient falls below 25, then the person will be having a profound mental retardation or mental subnormality. Earlier, this grading was considered as imbecile, idiocy, or feeble-mindedness, or morons. That is being replaced by these new terms such as mild, moderate, severe, and profound mental retardation. So in this slide, I am going to define what is meant by psychosis and what is meant by neurosis and the subtle differences that exist between these two. So in psychosis, it is a state of mental illness which is characterized by disorder of behavior, and the person is being withdrawn from the reality. The insight is absent in psychosis, the empathy is lacking, and contact with the reality is lost. Whereas in neurosis, it is a state of mental illness where the patient suffers from emotional or intellectual disorders, but his insights remain intact, and also the sense of reality is present. The personality will not be changed, there is no disorder of thinking or thought. Then it is the reaction against conflicts and stress in the mind, that is neurosis. So this table lists the differences between psychosis and neurosis. In psychosis, the severity is a major one, whereas in neurosis, the severity will be a minor one. And when you talk about genetic predisposition, psychosis has a genetic predisposition, whereas neurosis does not have a genetic predisposition. The insight will be absent in psychosis and present in neurosis. Contact with the reality is lost in psychosis, whereas it is present in neurosis. Empathy, there is lack of empathy in a psychotic individual, whereas a neurotic individual may exhibit empathy. So these are the differences between psychosis and neurosis. Coming to the classification of psychosis associated with organic diseases. Psychosis associated with organic diseases are nothing but mental illness which arise from structural brain damage, and the organic psychosis are usually characterized by lability of mood, failure of memory, and deterioration of intellect, irritability, loss of social inhibitions, and various other traits. So in the psychosis associated with organic disease, there is actually a structural damage, brain damage, and that leads to psychosis. So in this we have dementia, where in dementia there is degeneration of memory and loss of power of judgment. Further, this dementia can be classified as senile dementia that occurs usually in all people that is more than 65 years, and there is another one that is called as pre-senile dementia which occurs in persons below 65 years. And there is pseudodementia, which may be associated with schizophrenia or diseases such as Alzheimer's diseases. Then there are drug-induced psychosis. The chronic use of certain drugs such as barbiturates, amphetamine, cannabis, cocaine, or LSD may lead to psychosis in an individual. Then psychosis can also be associated with a deficiency of vitamins such as cyanocobalamin or niacin deficiency may lead to psychosis. Then there is GPI. GPI stands for general paralysis of insane, which is usually found in meningococcal syphilis. The next organic disease which may lead to psychosis is epilepsy. Uh, it can be due to head trauma, or it could be tumors of the brain or the central nervous system, or parasitic infestations of the central nervous system. Then there is alcoholism, which may produce psychosis such as alcoholic blackouts, delirium tremens, alcoholic hallucinations, or Korsakoff psychosis, or delusion of jealousy. These are the various classifications of psychosis associated or due to organic diseases, organic brain diseases. In this slide, we will be talking about functional psychosis. Functional psychosis are nothing but mental illness which have no neurological basis, or there is no structural brain damage. They are characterized by mainly the disorders of thought. Example for functional psychosis include schizophrenia. In schizophrenia, we have various types such as simple schizophrenia, hebephrenia, catatonia, or paranoid schizophrenia. Then the second one is affective psychosis, which is usually associated with the mood disorders, and examples in that include the mania or depressive phase. This is functional psychosis. Coming to the diagnosis of mental illness. Diagnosis of mental illness is very easy in case of a typical case of mental illness. The soon you get the correct history and examination will help you to make a diagnosis in a typical psychotic condition or mental illness. But the diagnosis becomes difficult in case of early stage of the disease or in borderline conditions. It is very difficult. But the diagnosis of mental illness, the main objective of the clinical examination is to form an opinion about the patient's mind and degree of responsibility. So that is the main objective of the clinical examination in a mentally ill person. You need to form an opinion about the patient's mind, whether it is a normal one or it is being away from the normal, and also assume certain degree of responsibility so that you can be able to make a proper diagnosis. So in that we are going to go through all these different headings, that is preliminaries, that is taking about his name, age, sex, address, and the beginning of the time of examination and end of the examination, the family history of that particular person, and whether that mental illness runs in the family also, that should also be noted, the personal history of that person, and a thorough proper physical examination and the examination of his mental condition with regard to higher mental functions and other things. Then proper investigation, whether an X-ray is required, the blood, urine, a routine examination, or even EEG studies, that is electroencephalographic studies, can also be done in order to diagnose mental illness. And the last one is observation, which I am going to tell more about this. So before certifying any person as mentally ill, you need to observe him for a particular period. That person should be kept under observation either in a general hospital or a nursing home or a psychiatric hospital or in any other suitable place, and the period of observation in a hospital should not exceed 10 days. Every time you keep the person under observation, the period of observation should be limited to 10 days, and if more days are required before you form an opinion, then the permission should be taken from the magistrate, and further 10 days should be extended. And this period, the maximum period for which you can observe a person to form an opinion regarding his mental illness, is only 30 days. There is a maximum 30 days you need to observe him kept in a hospital. And coming to the certificate of insanity, that is, how do you certify a mentally ill person? To give certificate of mentally ill person, or for declaration of a person to be mentally ill, at least 3 examinations should be carried out by the doctor on different days and different hours, which are usually recommended. Then only you are able to certify him as mentally ill or not. Coming to the word called as feigned insanity. Insanity may be feigned by criminals to avoid sentence of death or long-term imprisonment. Then how do you diagnose this? By what characteristic findings you are able to differentiate it from a real insanity? In feigned insanity, the onset of the symptoms will be sudden. They are not gradual as seen in case of real insanity, but the onset of symptoms of insanity or mental illness are sudden. The motive, when you look into the motive, there is always some motive before the person exhibits certain symptoms of mental illness. And the physical appearance of the person may be normal, or he may be expressing overreaction, or his expression may be frequently changing. So these are the things that you see in a feigned insanity. And the mood of that person is either overreacted to show that he is actually suffering from the abnormality of a mind. The signs and symptoms are not uniform, and there is atypical presentation in feigned. On observation, the person appears to be pretending to be mentally ill. Physical activity, the person gets exhausted like a normal person. Habits, the personal hygiene of that particular person will be very good. Medical examination, whenever a doctor wants to carry out a medical examination, the person may resist for fear of getting detected. So there is a fear for repeated medical examination, and the recovery is usually very fast, and if the person is granted bail or released from the psychiatric hospital. So this table lists out the difference between the real and the feigned insanity. The features are: onset of symptoms are gradual in true or real insanity, whereas sudden in case of feigned insanity. The motive, there is no real motive behind the development of a real insanity, whereas the motive such as the occurrence of a crime or any other purpose will be there in case of a feigned insanity. Predisposing factors are present in case of real insanity, whereas absent in case of feigned insanity. Signs and symptoms are uniform in real insanity, whereas the signs and symptoms will be present only when being watched or observed. The facial expression, in real insanity, the patient has a vacant look, whereas the facial expression keeps changing in case of feigned insanity. Insomnia is present in real insanity, whereas absent in case of feigned insanity. Exertion is absent in case of real insanity, whereas present in case of feigned insanity. habits are very dirty in case of real insanity, whereas they are clean or not so dirty in case of feigned insanity. The skin and lips appear very dry in true insanity or real insanity, whereas the skin and lips appear normal in case of a feigned insanity. The frequent examination, the person who is suffering from real insanity does not mind frequent examination, whereas in person who is pretending to be insane or mentally ill resists the frequent medical examination for fear of detection. Coming to the brief about Mental Health Act. This Mental Health Act was passed in the year 1987, and the act is mainly related to the law relating to the treatment, care of the mentally ill person, and to make a better provision with respect to their properties. So the main provision is for the treatment and care of the mental ill person. So among that, the restrainment of the mentally ill person is explained. How do you restrain a mentally ill person? There are two ways of restrainment of mentally ill person, that is immediate restrainment, and the second one is admission to a psychiatric hospital. In immediate restrainment, it is done in case of mentally ill person who is very dangerous to himself and others in the society. Before you immediately restrain a person, consent of the guardian is necessary if you have time, or if there is no time, then immediate restrainment is done by under personal care, that is by simple lockup in a room. In second one, that is admission to a psychiatric hospital, the following procedures have to be adopted, and that is according to the Mental Health Act 1987. The first one is the admission, and the second one is discharge of a mentally ill person from a psychiatric hospital. How do you discharge? So in the admission process, the first one is the admission on a voluntary basis, that is voluntary admission. The patient can be admitted to a psychiatric hospital on patient's own request if he is a major. If he is a major. In case of a minor, the request of the guardian is accepted. The officer in charge of the psychiatric hospital will make an inquiry as he may deem fit within 24 hours, and if the officer in charge feels that the person requires treatment as an inpatient, then he may admit such person. This is the most common method, that is the voluntary admission. If the patient walks into a hospital and requests that he needs a treatment, then the officer in charge will make necessary inquiry, and if he considers that the patient requires admission and treatment as an inpatient, then he may admit him to a psychiatric hospital. And the same applies in case of a minor on a request made from a guardian. The second one is admission under special circumstances. The patient not willing, but the relatives apply in writing for a admission to in charge of the psychiatric hospital. The patient is not willing because he is not able to make a application because of his mental illness, and the relatives consider that admission to a psychiatric hospital is necessary, so they make a written application to the officer in charge of the psychiatric hospital along with two medical certificates. The medical certificate must be given by two registered medical practitioners out of one. One should be from a government service, and the admission can be made to a period of 90 days. 90 days. The third one is reception order on application. In this reception order on application, the officer in charge of the psychiatric hospital may apply to the magistrate for continuation of retention and detention of mentally ill person in a psychiatric hospital because he considers that the treatment is required which may extend more than 6 months, and that is for the betterment or safeguarding the health of the mentally ill person. Similarly, relatives of mentally ill person may apply for a magistrate for reception order for retention or detention of mentally ill person in psychiatric hospital for continuation of the treatment, and that relatives, the exact relatives, he should be a major and he should have seen within 14 days of the mentally ill person and observed him, and he might have made a decision to retain him within the psychiatric hospital for further period for further treatment. So he makes an application to the magistrate for reception order. Once the magistrate receives the reception order, he may go through the details of the case, and if he is convinced, he may issue the reception order immediately, or he may fix a date for which the petitioner is known to appear on such particular date and receive the reception order once again if the magistrate gets convinced about the case. The next is the reception order on production of mentally ill person before a magistrate. If a police officer sees a mentally ill person wandering on the street who is dangerous to himself and as well as to the society, he may detain him in custody and produce him before magistrate for reception order. The magistrate, after examining him, may direct him to a doctor to get him medically examined, and if he is convinced that the person is mentally ill, then he may pass a reception order for retention and detention in a psychiatric hospital. Similarly, police officer, if he comes to know that a mentally ill person is not kept under proper care and control by the relatives or the guardian and is being treated cruelly or neglected, then he may detain him and produce him before the magistrate before the magistrate and magistrate may once again direct him to get medically examined, and if he is convinced that the person is mentally ill, then he may pass a reception order for admission of the mentally ill person. Then the next one is admission after judicial inquisition. If it is found that the mentally ill person is incapable of taking care of his property, then the court may pass a reception order or admission of such mentally ill person into a psychiatric hospital upon an application made by any relative. Then admission of mentally ill person. A mentally ill prisoner can be admitted into a psychiatric hospital by the order passed from the appropriate authority under the various Prisons Act or Air Force Act or Army Act or Navy Act or under section 330 or 335 of the Criminal Procedure Code. So this is about restrainment of mentally ill person under various headings. In this next slide, we will talk about discharge of mentally ill person from a psychiatric hospital. A voluntary person who is admitted on a voluntary basis must be discharged within 24 hours of the receipt of request for discharge made by the patient himself or the guardian. Then the second one is admission by application. Such person who are admitted by application can be discharged by request from the relative, but it must be first made certain that the patient is fit to be discharged. The third One is the officer in charge of the psychiatric hospital can order the discharge of any patient on recommendation of two medical practitioners, one of whom should be a psychiatrist. Fourth one is a relative of mentally ill person can make an application for his discharge even if he is not fully cured, provided that he is not dangerous to the society and he guarantees that he can take care of him in a suitable place at home. The last one is a person detained on reception order can be discharged if a judicial inquisitions find him of a sound mind. These are the various procedures from which you can discharge a mentally ill person. So this was about today's class, that is regarding classification of mental disorders according to ICD-10, WHO recommended, and also the brief about Mental Health Act and restraint of mentally ill persons. So thank you students, thank you very much.